That was quite a morning. Can we give one more round of applause to the patient panel? And there has been a great conversation on social media around a lot of great insights in the patient panel, so please check that out. One of the comments that we had was, how do we loop that patient perspective, not just on a panel, but throughout the conference? And I loved that comment. And I love that suggestion. So we are going to continue that, thinking through that as we plan for next year's 5 Points of Healthcare conference. But it is not all lost on this one because we have a number of, everyone's a patient in this room, of course. And then we're going to bring everyone back up to the stage after all of our panels. So I know we are on a tight timeline, as you heard. As we really need to get people settled back down, we do have a cowbell that will be rung, but we are all back and ready to go. So please join me in welcoming our provider panel, and specifically Gary Rendell, the Executive Director of Project Access Northwest. Go ahead and take it away. Thank you.
As I turn on the microphone now. Check in just a second. There we are. Good morning, everybody. My name is Gary Rendell, and I just want to say what a thrill it is to be here today. And I want to encourage you all to give a round of applause to Cambia Grove. So for letting us have this experience, for being this kind of bright, shining spot in Seattle on a bit of a cloudy and kind of rainy day, where we can literally come together and kind of lighten up not only ourselves, but each other as well in story and in kind of real thought-provoking question and discussion. So a round of applause to Cambia Grove, please. I have a board member in the room, at least one board member in the room from Project Access Northwest. So in full transparency, I want to tell them that I am honored to be moderating today's panel, and also just was a little bit nervous as I took a look at what I was being asked to do, and then kind of the joy I had and the time that it took and the real fun that I had, away from what some board members say, hey, shouldn't you be doing that? Shouldn't you be doing that? Instead, I was listening to podcasts and looking at bios on LinkedIn. And then that led me to a video on YouTube. And what I thought was going to be an hour of research came into be many wonderful just opportunities to learn about these amazing folks that are up here. And I'm excited for them to share their stories and answers to your questions today. Very quickly, just a brief kind of, if you will, commercial for Project Access Northwest and who we are and what we do. We were founded in 2006 by a person who many of you in this room may know, Sally Neely, who knew that there was a problem and a bridge to be had for folks who wanted to provide charity care, but didn't have an efficient way to do that. And then a bridge for patients who needed to get into specialty care from a primary care provider, but had no place to go and didn't know how to navigate the system in order to do that. So since that founding in 2006, we've seen 50,000 patients, or about enough to fill, more than enough to fill T-Mobile Stadium. And we've worked with an extremely well-dedicated and professional network of 1,700 medical providers in King, Kitsap, and Snohomish County to ensure that patients are receiving the care that they need. So that's a little bit about us. Our panelists are going to each introduce themselves, but I will tell you during our hour-long session that we had to plan for today, I heard a number of wonderful things. I don't know if this will show up in your introductions of yourself today, but some things that I wrote down that you may want to ask them about afterwards if you don't hear in their introduction are things like a polarity mindset, podcasts, sacred encounters, an Own It program to preserve sacred service of healing, sunglasses, reimagining the patient, family, and provider experience through digital technology, and a song that I still can't get out of my head after seeing this video, SpongeBob SquarePants and PT. So with all of that, I'll turn it over to our esteemed panel here.
Thanks. Rochelle Doherty. I am the Chief Administrative Officer for the Physician Enterprise with Providence St. Joseph Health. And so we employ about 7,400 providers across the 7 states where we serve. I've been with the organization about 16 years and am honored to be here as a provider and a little nervous after that patient panel, I'm not going to lie.
Yeah, I'll echo that. That was pretty pretty relevant and realistic for what everybody's experiencing in this room. I think we all have been through those similar horror stories. So excited to jump into that a little bit deeper. My name is Eric Meyer. I work for the Innovation Studio at Children's Hospital Los Angeles, and I was not prepared for the rain today. Really, the core function of what I do and what our team does is something that I have found to be incredibly profound and has given me a lot of purpose in healthcare. And it's really understanding what are the problems and challenges within the hospital, within the health system, and connecting the experts within the hospital to technology outside the hospital. And so a lot of my work is really building partnerships and building an ecosystem in order to solve problems. And more specifically, in pediatric healthcare, it's been extremely rewarding. You just get involved with so many kind and people that really want to help. So I'm excited to talk more about that, but very grateful to be here. So thank you.
Good morning. My name is Michelle Trosit, and I'm a nurse. And I'm so excited to be here today. I actually got here, I met Nick at a conference a year ago. He got to know a little bit about the work that I'm doing at Missing Logic, and so very excited to share that with you today. I do have a podcast called Healthcare's Missing Logic, and I'm also the person with the sunglasses. So let me tell you about the sunglasses. This is about looking at healthcare through a new lens. I've been in healthcare transformation for 30 years, working with healthcare organizations across North America. And at the end of the day, the biggest takeaway myself and my co-founder, Tracy Christofferson, who's a respiratory therapist, had is our problem is that we look at everything as it's a problem. And we go after it to fix it, not recognizing that there's another part of it. We're not looking at it holistically. And so in 2017, I became the president of the National Academies of Practice, and we started Missing Logic. And we do coaching and consulting with healthcare leaders around how to have a polarity mindset. And I'll just give you an example in listening to the patients, some common tensions or polarities that showed up in their stories were, yes, I want standardized best care for my diabetes, and I want individualized care for me as a person. And if we look at it that way, we just find it makes the actions we take more succinct, and we get sustainable outcomes. So like Robin, who was on the patient panel, Tracy and I are starting a movement to have a lot of polarity thinkers out in healthcare, and we're really excited to be here.
Wonderful. Another round of applause for our panelists, please. Rochelle, Eric, and Michelle. For each of you in the hour that we spent together, I think a number of themes were emerging, and I'm imagining those themes might emerge during the first question for us. But themes that seemed to resonate with all of us during our conversation were things like role of partnerships, if you will. How do we all work together? The tension, if you will, between technology and practice, the breaking down of silos, the creating cultures and bridging from inside walls of hospitals and clinics to communities. So I'm betting that a lot of that is going to come up here in the next, what do we have, 2-3 hours together while we're at it? So I'll rephrase the question that we were just asked, and we'll just go right down the line for answers to the patient question for the providers. Given that providers can't know every solution that exists in the world, how do you partner with your patients to address their health?
I think if we were all listening to the patients in the last hour, we heard the answer, right? They want to actually be heard. They want the time to actually be known, and they want the time to really effectively be able to have a two-way communication and relationship with their provider. And I think knowing now that we are able, and we're at a point in medicine where information is coming at us so quickly, new information, new knowledge, that there is no possible way one single brain can contain it all. I'm just really excited that once we can figure out how to get that AI into the hands of the provider, it's really going to free up an entire new workforce who maybe can concentrate on EQ as much as IQ. And I think that's going to be just game-changing to the patient-provider relationship. Super excited for that.
Wonderful. Eric?
Yeah, just one comment, and being on the provider side, I think everybody that's worked in healthcare has probably heard from family members that have gone through healthcare experiences. And just yesterday, my mom texted me, my uncle had surgery a couple days ago, and he wants to talk to me about a hospital because I used to work at this hospital, he had surgery. He wants to talk to somebody because it was just a horrific experience. They don't know what they're doing. And so, we do hear that a lot, and everybody has experienced a lot of those things. And there's so many good people trying to do good things in healthcare that it's just, just look at all the people in this room, how many people are here and how many resources are put into healthcare. It's really profound and really keeps me motivated every day to try to solve a lot of these challenges. One of the ways, so my background is in design thinking and human-centered design, and I live and breathe empathy. And even this morning, just hearing some of the examples, it gets me, it still gets me. So a lot of what we do is, design thinking and the methodology is profound in every project that we interact with. Anytime we're building a new solution, trying to build a product, or engaging in a new process, we really first want to understand who are the users, who are our customers, who are the people that are actually going to be using this product, for example. I'll give you one example. I'm working on a project right now for patients that speak Spanish. Over 60% of our patients in our community in Los Angeles speak English as a second language. And this community has a lot of challenges accessing healthcare resources, and so we're building a product really focused on social determinants of health to reach this community. And what we're doing, rather than just jumping into spending $200,000 on a prototype of this app, I've spent the last 6 months, going into the community, going and talking to people. I've had so many people just sharing their stories and crying about food insecurity and how embarrassing it is to walk up to a restaurant and try to get food for their kids because they don't know how to access healthy foods. Or people that, other kids eat McDonald's 4 times a week because that's just the way that's all they have in their area. And so we spend a lot of time deliberately up front during that empathy phase, really understanding and building a profound connection with the need of the person we're solving for. So that's really all throughout all of our projects, and I could talk about all of them. Some other ways that we engage in patients, at the hospital, we have a program called the Junior Ambassadors. And they're kids that are either former patients or current patients or just volunteers from the community, and they give us feedback on different projects that we're working on. So some of the things that our team has led is the building of our digital health lab, and the focus this past year was virtual reality and augmented reality and gaming. Our theme was gamifying pediatrics. So we had all these kids come in and give us feedback and test out the games and really understand what they want, what they like, and what they don't like. The other last point I'll make on this question is one unique thing about pediatric healthcare is that you're not always treating the patient, but you're often treating the parents and the family as well. And so it presents unique challenges with care. It was interesting. I was at another conference that was led by Mars Pet Care, and it was just pretty profound how many similarities we found in taking care of animals and taking care of children. Most of the time, you're taking care of the parents, and so I think that's really embedded in all of our work. Is how do we include the family as a part of a system? The siblings that feel left out when all the attention's on the kid that's in the hospital, and so we very deliberately try to focus on the family unit as a whole in the hospital. So I'll stop there.
Wow, you do a lot. Those are all great. Well, I'm going to start just from being a critical care nurse in my background. One of the key things I learned is just how much it is to have a mutual goal with the patient and family every single shift that you work. And so part of that process is just asking them whether you're with them for 4 hours or 12 hours, okay, What's the most important thing for you today while you and I are together? And it could be washing your hair. It could be some simple things, but then you can integrate it into your very busy day, and that makes a really big difference. I think taking that concept and then scaling it up, in the work that we do, we have a healthy healing organization, H2O framework, working with organizations, and we actually teach healthcare leaders and clinicians principles of dialogue and principles of partnership, and how to apply them every single day with their colleagues and with patients. And for example, the first principle of dialogue and of partnership both is intention, and how important intention is. So in dialogue, I intend to come to this conversation with you to really honor who you are as a person and to really listen. And there's, of all the work we do, and it came up from the patient panels, we all need to do our greatest work around listening. And we do these listening exercises, and people just can't believe how they recognize they're really not listening. They're thinking about what they're going to do in the next room. They're thinking about what's going on the next meeting they have to go to. So it's really powerful just to do those simple exercises with people, and to learn how to ask really good questions to your patients and to each other as well. And the same thing with relationships. It's really about the intention we bring and how we are together, and it can just drastically change so much in a culture. And these are cultural shifts that need to happen with these skills of dialogue and partnership. And I always like to use the example that intention is a core one for both of them. And I recently found myself in a very not unusual situation. My father passed away 2 weeks ago. And he had been chronically ill with congestive heart failure, and we suspect probably had developed a cancer of unknown origin. And I'm the nurse, right? And I travel quite a bit, and I recognized, okay, we gotta move quickly now, because his health was declining. And I just said to myself, Michelle, go back to the basics. Ask your dad, what do you want? And then I found myself having to model to every physician office I went to. And it was just this experience of going with them to all these appointments and recognizing what everyone said, all of the silos, and then trying to be the change agent in a family situation at the same time. And then the last appointment we went to his internist, it was all about whoever said the blame and tame it. They wanted to tame his heart failure, go back to the cardiologist, and I said, stop. The question is, we need to be talking about palliative and hospice care. The time has come. And it was the best thing we ever did as a family. And I can tell you, after experiencing about 3 weeks with hospice care, I think the whole healthcare system needs to learn from hospice care. It was an incredible family experience, and my dad died peacefully at home with his family around him. But it was asking the question, going to the appointment, before we go, what do you want? Okay, then we have to tell them that's what you want. And it's really, you have to ask and you have to listen. It's that simple.
Sorry for your loss, and thank you so much for being willing to share that story with us all. I'm going to need from Cambria Grove to have another 2 hours for this session. There's so many questions and so many follow-ups. I think, though, with thanks to the patient panel, right, for the questions, I think that what we heard in there was the importance of leading with empathy, a focus on social determinants of health, making sure that we're clear on mutual goals, listening, asking questions, asking the patient what they want, what their goals are, what their needs are. And also kind of some excitement around kind of introducing AI into the hands of the healthcare providers themselves. Is there anything in there we missed, or anything that anybody wants to circle on, or even talk about a pain point in any of that you're like, boy, if we could just do this, that would be amazing?
And as they were both speaking, I thought, and the big key missing piece, and you said hospice has it nailed, they have time. They have time with the families and time with the patients. So how do we think about freeing up our providers to really be able to get to know and listen?
Mm-hmm. Time. Wonderful. All right. Well, thank you all so much for the answer to that first question. Let's pivot and go on to the next in our kind of list that we have. The next one is, what are all of the different roles providers play in the healthcare system, and how has it changed over time? So, Michelle, if you don't mind, we'll start down with you on that one and then work our way back this way. But again, what are all of the different roles providers play in the healthcare system, and how has it changed over time?
So I think what's really significant about that question is there are different healthcare providers, different professional roles. And the most important thing I've learned about that is knowing your own scope of practice and knowing the colleagues that you practice with, their scope of practice. And there's areas that are very unique to a physician, to a nurse, to a dietitian, to a respiratory therapist. And then there's areas that we overlap. And what we learn is, and this goes back to how we're taught, is traditionally we were taught in silos. And so I remember as a nurse when I graduated, I didn't really understand the interprofessional team until I got out into the work environment. And so a good thing that's happening right now is that there's a real awareness of needing to increase interprofessional education, or IPE, and interprofessional collaborative practice. And it goes along with some of the trends in healthcare too, like value-based care and working in teams, like changing the way we are really thinking about individual and team. And so there's a lot of effort in the academia side now to train people together. So that's kind of a new, we've been talking about it for 50 years, that it needs to be done. So in that way, it's not new, but how do you do it? And then how do you do it so it's sustainable? And so now, now I think the polarity there is doing interprofessional education and interprofessional collaborative practice together. And then at a local level between education and practice, what is that partnership like so that it can be sustainable over time? So that's what I've seen change when it comes to roles over the last 30 years.
Great, thanks.
So I think one of the angles I'll take at this question is thinking about the change in consumer expectations of healthcare. Right now we could Google anything on our phones and have information in a second. Whereas, 30 years ago, even less than that, you access healthcare, you access your doctor to get answers to a problem. You want to go to the doctor to be fixed, or, know what's wrong with you. And now everybody you can find an answer for everything. You can find whatever you want to see or want to look for online. And so that, with the change in expectations for how we consume other services outside of healthcare, restaurants, and booking a restaurant. I could book a restaurant here in Seattle in probably less than 10 seconds. Even you go to your dentist office, like I get text reminders from my dentist, and why does it work for dentistry but healthcare can't figure it out? And really anything that we access now, it's just so fast, and it's really where we, meets us where we are and when we need it. And healthcare is a little different for many reasons that we'll probably actually is why we're all here with all 5 points. It's really a change in how we think about healthcare as not just this like 4 walls of the hospital, and more of this is a patient's life. And technology from our side at the Innovation Studio is how can we influence a person's life more so outside of the 4 walls of the hospital, because they spend a very small percentage of the time in the outpatient visit or in the hospital. Majority of the time is spent out in the home. And so for us, it's a big shift in thinking about how do we care for patients in the home and outside. And really, there's different types of healthcare. It's, your physical health, mental health, and even someone said earlier, like your financial health, like that really impacts who you are as a human being. And so I think the shift has been really profound in thinking about the patient as a whole.
I think that goes along very much. I was driving here this morning thinking about this, and maybe just coming off of the Super Bowl. Sorry for those of you who lost.
Huge United fan.
I was happy. So I kept thinking about this evolution and in terms of, I think we've, for a long time in Western medicine at least, thought of this, especially the physician, as this coach on the sidelines, calling the calls and doing the work from the sidelines while everything else got done on the field, but they were in charge. And I think as we look at this, and I haven't had enough time to play out the whole thing, so bear with me if I get it a little wrong, but as we think about the move on to the field and whether they at sometimes are playing the quarterback role, or at sometimes they're playing that voice in the microphone, or at times they're playing whatever safety, whatever role that is, you think about that, and one of the examples from the patient panel I think Eileen gave around diabetes was really being able to partner in that. And technology, have that technology be part of that game. And when we think of the provider relationship, it can't be I'm the doctor and that's the provider, but what software am I giving them that are helping them in their care? And I think the shift from the sidelines to on the field is that same shift from healthcare to health. How do we make it to where we really can start to be in this together, using all the tools, all of the care team, as well as the virtual things that are coming or here.
Wonderful, thank you all. So I again, one of those kind of little rabbit trails that I went down as I was getting ready for today's session was to look at this panel prior to us, when it was actually, I think, an hour and 45 minutes long, but gave us some really good kind of insights to kind of where we've been, where we are now, perhaps where we're going. I think that the moderator at that time talked about kind of our system and how it's built off of a chassis that was really built in 45 or in the 40s, and that there's so much that has changed now, right? And kind of not only where we've been, but where we're going. But that the elements of an ideal system have changed since that kind of time frame and that thinking to today of kind of being an ideal system that is focused on being patient-centered, timely, efficient, effective, and equitable. And I'm wondering how those kind of things kind of play into the answer that you all just gave as well, or if there's anything else in there that might be added to that as you think about kind of that ideal system of being patient-centered, timely, efficient, effective, and equitable. And again, pain points around that. Anybody want to jump in and take that first?
Well, he's referring to the 2001 IOM report, Crossing the Quality Chasm, and probably all of you recognize those elements, those 6 elements. A funny story about that, because I know I'm with a group of people that we're all here to serve. And when you get into healthcare, no matter what your role, it's like, okay, what do I need to do next to really serve? And in 2001, I made the decision to leave a big healthcare system in Grand Rapids, Michigan, to actually join a consortium work with healthcare organizations around North America to improve professional practice. And I had a week off between jobs. Doesn't that feel good when you have a week off between jobs? And I was out to breakfast with my husband, and we were leaving the restaurant. And you know how they have those newspaper stands all lined up outside of restaurants? And I looked over, and the USA Today said, in big letters, U.S. healthcare system broken. And I said to my husband, give me 50 cents. And he's like, what? So I took the USA Today, I sat in the front seat, and it was that report when those 6 principles that had just coming out. And I'm reading it in the car, and I'm like, this is why I'm doing what I'm doing. I'm doing it because it is broken. We've got to get everybody engaged. And, you know, that report now is 20 years old. And we're still sitting in rooms like this having conversations. So, of course, I know what the missing logic is, but there's still so much that we have to learn from those reports. The err is human, crossing the quality chasm, and I think the best thing we can do is just, what are we learning? You know, what's worked and what isn't working. So I think that's what thoughts I have about that.
Anybody else want to jump in?
Well, I mean, just one little point that's maybe kind of interesting. So I've worked for now 4 different health systems, and you would think that, you go to one place, different culture, different processes, different things. Every single one across the board is really trying to focus on the same things. And really everybody across healthcare, of course there's little nuances, but really focused on the quadruple aim, or triple aim, now the quadruple aim. It's really profound because I think just focus on efficiency everywhere you go, length of stay. It's all a lot of the same metrics. So I think it's just really interesting that I thought, going from one organization to another would be very different. Like our strategic priorities here, we have different types of patients here, different population, but it's actually very similar, really what the strategic priorities are. So that's pretty interesting.
So with all of that, right, broken systems, still talking about the same things we've been talking about for 20 years, and technology is here and coming even stronger. Where do we start, right? Where do we start to fix the problem, if you will? We've got a couple of different buckets in here that we've chatted about before. It's about future workforce, reimagining the patient-provider experience, and provider burnout. And so our question will be kind of what are each of you doing, or what do you see needs to be done within either, if you want to tackle all three in your answer, or just choose one of those buckets. But if we look at future workforce, for example, right, we see that according to data published by the Association of Medical Colleges, the U.S. will see a physician shortage of up to 122,000 by 2032, inclusive of both primary and specialty care. If we look at reimagining the patient-provider experience, we see that each year almost 3.6 million people miss or put off medical appointments, leading to annual provider costs in the billions, and all of the issues for those folks who aren't able to make it to their appointments. And when you look at provider burnout, a 2018 article found that about 9,000 respondents across all the states, 38% of physicians, so back to an earlier point made in another panel, have feelings of professional burnout. With all of that going on, right, where do you start, and what's the answer?
Just that, right?
Just that. Eric, you haven't started yet, so let's have you go first.
All right, so we could go through this for another hour, but I think two that have been really profound for us. One, just starting with provider burnout, I think it is massive and growing. We always talk about, and someone mentioned earlier that a physician or provider went into school to build a connection with their patients and do what's best for their patients, but spending a lot of time in outpatient, specifically for primary care, it's just so difficult. You have to make a choice. Do I want to build a face-to-face connection with my patient, or do I want to document my notes and get everything that I need to finish while I'm in the room with that patient? Or, am I going to be doing it at the end of the day, where I'm going to spend 3 hours at the end of the day at the clinic and away from my family? And specifically, extremely in primary care, and more so in primary care and everywhere in healthcare, it's just really a burden that is not a lifestyle that anybody wants to live every day. And so that's been a massive focus for us, and I think it is really one of the reasons why our innovation team was started. So our team was launched about 2 years ago, so a little bit less than 2 years old. And a lot of what we do is meet with providers and understand what's going on. Talk to me about what your life is like, and what are the ways that we can help. And a lot of them, they have all of these frustrations and things that they want to fix, but don't necessarily know how to fix it or who to go to or what to do. And so a lot of our work is meeting with them and figuring out, okay, this physician has a really incredible idea for an app that they want to build, or a game that they want to build for kids, or something they want to do in their clinic. We know 30 different companies out there that are trying to do this, but don't understand the actual use case that it can be applied to. So why don't we try to connect those two worlds together to build something together? And so that's been a really interesting approach for us to try to tackle provider burnout. I think one other big issue that I'll mention for us that's just really important is social, and we've had it, and emotional determinants of health. Looking at mental health for kids, especially growing up in a world with social media and just the expectations that are put on kids and things like, they see their friends are all hanging out together and I'm missing out because I'm at home and I can see it all on Snapchat right now and they didn't include me. It's incredible how much these kids are going through now. And so mental health and giving kids access to mental health resources has been a really big focus for us. As well as this upcoming year, a big focus of ours is going to be around food as medicine. So food insecurity, childhood obesity, and access to healthy foods. And we're going to go with a similar model of meet with people in the community and understand what are the problems, what are the challenges, and then how can we create an ecosystem of partners and tech experts that can help try to solve those problems. So those are just a few of the buckets we're focused on.
Wonderful. Rochelle, I'll let you go next. I know we're going to get some time challenges here soon, and I don't know if they'll actually play music to get us off the stage or how that'll happen, but we also want to leave time for questions too. Go ahead.
Yeah, so I'll tackle one of the different ones then, though burnout is a passion. No, it's good. And I think the workforce piece is huge, and it's twofold. It's how do we take our current provider workforce, whether that be the physician or their care team or the technologies that we can or should or are implementing, and really get those to be the most effective at providing the care where and when and how it's needed. And then that's the only way that we're going to plug this. We are not going to be able to plug the 100,000+ gap of physicians that we're going to see. And so we're working really hard on kind of two pieces, really looking at the care team and how to use advanced practice providers in a different way, how to use all of the care team, our mental health practitioners and our pharmacists in different ways. And none of that is revolutionary, but it's hard. It's really, really hard to get it done right in this model. And then I think the other piece is really stop competing in our communities. And we look at all of our competitors and we're all trying for the same tiny, tiny pool. And so Providence has really gotten serious about how do we partner with like-minded health systems who are all in it for the same thing? And how do we look at the community as a whole? Where are the gaps and how can we fill it as a community? And so I think those are two just of many I could go for.
Thanks. Great. Michelle?
Yeah, well, there's a new report out, in case you haven't heard. And the IOM is now called the National Academy of Medicine, or NAM now, and it started an action collaborative. And this report just came out a few months ago, in the end of October, taking action against clinician burnout, a systems approach to professional well-being. So we recognize this as a serious national crisis. And so I think really focusing on healthcare leaders is important. There's a lot of emphasis on clinician burnout, but in reading the report and recognizing the tensions that are in this report is a lot of it's going to fall on the leaders to what? Fix it. Fix the burnout for your team. So we're working with leaders to help them really help themselves put your own oxygen mask on first, right? Before you try to fix everything for your team below you. And then also working with healthcare organizations to help them have a plan to deal with this. So the information about the podcast is on the back table with the books. And next week, the executive director from the National Academy of Medicine is going to be talking on the podcast. So there's information back there.
Wonderful. Thank you so much. And we do have time for questions. So we'll go ahead and open it up now for those.
Great insights. Quick question. As we look at the healthcare landscape, especially over the last 10 or 15 years, we have more technology, we have more burnout, and we need individualized medicine. So how the three things are going to play together from a provider perspective as we try to improve healthcare? And I don't know the answer to it. I'm a healthcare faithful. I've been in this industry for as a student as well as a professional for more than 20 years. The same problems that we are solving 20 years ago, they still persist right now. They haven't gotten any better. But I'm just wondering, is it a change of mindset? Is it a change of approach? Is it a change of, I'm just curious. I don't know what I don't know.
Michelle?
Well, I would say it's a great question. I think it is a change in mindset, and even like just taking the clinician burnout for an example, there's a huge emphasis on fixing the system for burnout, which yes, we need to do. And we need to focus on the individuals within the system. And I loved the comment that came up earlier during the patient panel about the individual. It was that gentleman in the red shirt back there. You brought up the importance of the individual. What's my accountability as a patient? Same question here. What's my accountability as a provider for my own well-being? And you have to do both to get to that greater outcome, to have it be sustainable. And so almost everything we look at, I think we have to ask ourselves, is it a problem or is it a chronic tension that we need to manage? So I think that's an important next step.
Well, and I'll just say that health systems have taken too long, and that's why tech is involved, right? That's why they're there. We've failed miserably, and so consumers are at a point where they're very rightly very outraged. And so I think it's going to be fixed whether we like it or not. And I do feel confident about that because we have folks who are more knowledgeable than ever who aren't going to allow status quo to be status quo. And I hope we can do it in a way that we preserve the good parts of the system, but we probably need to break a whole lot of it too.
I agree. I think that there's a lot of big companies really getting into healthcare, Microsoft, Google, Amazon, Walmart Health and Wellness is doing some really interesting stuff. I think just on a sort of micro scale, what we see a lot is people throwing technology at a problem or something that's not actually a problem. And so that's always like our biggest fear is spending money on something that's just going to sit on a shelf and nobody wants and nobody's going to use. And so for us, that change in mindset is what like value is this adding to the patient or provider experience, and really digging in on that. Just because it's cool to have a virtual reality headset does not mean we need to bring virtual reality into this department. It's like, what is the value that it's bringing?
Great. We have a question over here.
Hi, Jocelyn again. I kind of wanted to piggyback on what you just said, which I totally agree with because it's related to my question, so from my viewpoint, I've worked in many facets in the healthcare industry, and one of the things I see, I know what my feelings are, but I want to know what everyone thinks about the degree to which the business involved in the healthcare industry, the degree to which that's impacting the issues that we have.
I mean, for us personally, it's massively impacting because a lot of it is, at least for technologists, who's going to pay for it. So that always comes into play that, it would sound great to build an app that's going to, be able to schedule your appointments immediately and text your provider, but how are we going to pay for it? And how can we make that sustainable business model to, show an ROI for ourselves? And so that's constantly, when I came into this role, I sort of had a naive mindset that like, we're just going to build all these cool things, but you get sort of like brought back to reality and realizing, okay, this is a business and we do have to find a way to make this sustainable. And so, again, that's really forced us to be focused on what is the value that we're actually providing.
And I would just go back, that piggybacks perfectly on his question, because if we look at health as a human right versus healthcare as a business, you're solving two very different things and you're using very different levers. And you're not having to ask that question in one of those camps, and you have to think about that all day long in the other, and therein lies all of the work, I think.
It's leveraging margin and mission. That's all I'll say because we're out of time.
Thank you for helping me to manage that. I appreciate that. So, with thanks to the patient panel and thanks to the esteemed folks up here, Rochelle, Michelle, and Eric, we have a question, of course, for the payer panel, which is next. So that question is, what changes in healthcare, workforces, and technologies are payers prioritizing, and how are they preparing? Look forward to hearing the answer to that after we get back.
Thank you, Gary. Please join me in thanking the panel here. Thank you, guys. Covered a lot of grounds. We could have done this for another day and a half. Thank you.